So we just want to have a quick presentation to you now about why you should be a member of the college. What's the point in paying you $2,000 or whatever it is we're charging now, and why bother with any of that? It's a question that many people would ask. Well, it's advocacy and education really, and professional development. So really what you're trying to do is have an organisation of like-minded people with similar qualifications that have a voice to government, both at state and federal level. The college has a long time history of achieving that. That's undeniable. It's in the legislation that we've been able to achieve that over the years from a lot of hard work. But having a one voice body to talk to the government on the different levels is imperative for a surgical group, and we've managed to do that and continue to do so. Education, as you know, we have a fellowship training program which we're very proud of and continue to develop and work on, largely to all the work by Mark Gilheeney, which we're really grateful for. Our accredited program will be up for accreditation again this year, and we're very confident that will come through. And we have every intention to continue the education and training program as we move forward. Probably the biggest thing to think about is professional development, and we'll touch on that too. But what is a college anyway? Is it just a group of people with secret handshakes standing around, like something in Lord of the Rings? One wouldn't have thought so. One would like to think that it's a group of like-minded professionals who are there to support each other. And I'll talk to that as we move on in this short presentation about peer review and professional support at the times when you most need it. And to me, that's one of the biggest things as to why you'd want to be in a college. Because the college, the Australasian College of Podiatric Surgeons, provides that like no other group. Not the association, not the APOD, nobody. We have the knowledge on how to do this and how to support you in a way that you won't get anywhere else in this country. And particularly when we talk about professional identity, we're going to get a presentation from Seamus at BMS, who will talk about the claims in the last 12 months or so. It's been made abundantly clear, and you'll hear that in the presentation, that your premiums, they may be higher than you like them to be. They're lower than if you weren't a member of the college, and that's without doubt. So if nothing else, which is a bit sad if there is nothing else, but if for nothing else, you get a lower premium because you're part of our group. And that's largely because of the weight of numbers, but also because of our peer review process. And then advocacy really stretches onto all these things. Look at all the other things we've been able to achieve. Largely to all the hard work of Gilheeney, we achieved professional attention in 2004, and that was a landmark change in legislation, without which we wouldn't be here. There's no way that we'd exist without that. And great gratitude to Gilheeney for doing that for us. That followed on with prostheses. We're working on TGA now. Haydar Oskan's working on that for us, and we need to keep following that through. So when you're asked to provide information and help out with these projects, it's important that you do so. This stuff all happens at no cost or no charge by the people who do the work. I can tell you that us older guys, Gilheeney and myself, are starting to get pretty tired, and you need to step up. You younger people need to step up. You need to start getting onto boards and committees and start taking part. This is your future, we're on the way out, and if you want a strong future, if you don't take part, it's going to die, and you will not get represented the way you need to. So it doesn't happen by itself, and you need to work with that. Specialisation, endorsement of scheduled medicines, again, back to Mark. When we got to 2010 and his position on the board, he fought for our group, really, and got that established for us. And without that, we just wouldn't be able to practice the way we do now. Increasing recognition with the private health insurance. People will complain about the situation with private health, and it's not where it should be, but it could be far worse. Our friends and colleagues in WA haven't had that problem that we've had in the rest of the country for the last 20 years. That said, there are some exciting things coming in the future. We've been trying to work with HBF in WA, and they were looking at setting up a no-gap insurance, even without Medicare. That unfortunately has fallen through. The numbers didn't add up. However, I was talking to Sarah Mackay yesterday, and they're looking at extending what they do provide in WA nationally. That'll be a game changer for us. So a voice to private health insurance industry is important. We can't do it all. You all need to get off your backsides and help with this. Okay, if you don't dig in, you won't get the support you need. But that's what a college is there to do, is to help break down the jobs and hand them out so everybody can work on that. And industry support. We're now working on getting sponsorship and support through our education fund from industry. So these are all the things that a college do. We don't just sit there drinking cups of tea and saying how great we are. There's a lot of work that has to be done. I won't tack on too much about this. We know about our education and the sort of problem we've got with developing and pushing that forward and building on what we've done already. The numbers are increasing now. We'll be taking more registrars per year. That will only happen if people help with supervision. You've got to help with supervision, people, okay? If you sit back and just look after yourself, this will die. So it depends on what you want, but I would have thought everybody in this room is here because they believe in what we do and they understand that we need to have an established and moving education and training program. You have to take part. If you don't take part, it dies. Okay. And the other thing about what we do as a group is providing evidence to show that we meet standards. The flagship of that is the college's peer review program, the online audit that's been running now for more than 10 years, and we're going to go through the next iteration of that tomorrow. That provides data that has helped us immeasurably for private health insurance. Even though we've got a ways to go, it still helps with what we're doing now. That's the only reason why HBF and WA are looking at us, is because of our audit data, both from a qualitative and quantitative point of view. And also it helps with insurance, without question. The fact that you've got a peer review process that will allow you to improve the quality of your work improves and shows that you're acting like a professional. And then you can show all this information to state and federal governments, Podiatric Board of Australia, all these different organisations. I can tell you when I was in when I was in Canberra in 2012, I think, when we first started pushing hard for MBS, I met a number of ministers and they were extremely surprised to see the level of audit that we do. And I heard numerous times that no other specialty is doing what we're doing, especially the 100% compliance. So these are the sort of things that you get from being involved with a college. And I can't emphasise enough the whole point of peer review. We can talk about this later, but just think about this. If you have some outcomes that you're not so comfortable with, the smart move, I'll cut to the chase, the smart move is to talk to the college and say, I've got these cases, I'm not sure, I need some peer review of this. We do that. We've done it in the past, we're doing it currently, and we can do it in the future. We have enough expertise across all aspects of reconstructive foot and ankle surgery that if you need some input from external people, and more than that, document the reflection that you do and the quality improvement, the college has the mechanism to do it. You can't even put a price on that. That is worth so much. So peer review, I'd actually put at the top of the reason as to why you would be involved in a college. And that all happens through our committee structure. And again, I can't emphasise enough, get involved. Pull up your sleeves, put in the hours, because the payback is worth it in the long run. Welcome to everybody.